Before you sign that contract, as a carer, as a senior carer, please watch this video. If you've not watched this video, don't sign that contract yet. I'm making this video so that you will know what to expect when you come to the UK, especially to my nurses that want to come to the UK via the senior carer route. Please watch this video to the end, share to as many as you can, subscribe, drop a comment down below just to help my channel, please. So I'm going to be telling you things to expect as a carer, as a senior carer, especially coming to the UK, so that when you come, you will have been informed. When you come, you won't be in shock. When you come, you won't say nobody told you. I'm going to be telling you everything, either coming as a senior carer in a care home, as a senior carer in the NHS, and as a senior carer in the surgery, which is just like outpatient hospitals. I'm going to be telling you everything you need to expect. As a senior carer, I know your salary may be a little bit higher than a carer. You know, you must have been told that you're going to be a senior carer, and then you have the mentality that you're going to be a mini nurse or a semi-nurse. It may not be the case in all situations. So let's start with working in the hospital. If you're working in the hospital, it may be a little bit different from when you're working in the care home, but they're still interrelated. I'm going to be telling you what to expect if you're going to be a senior carer in the hospital. So in the hospital, I'm talking about the NHS, either in any part of the world that you're being posted to. So as a senior carer, you're going to be expected to wash, dress patients. Yes, you have to. You're going to expect it to be moving them, but there are going to be a lot of equipment for moving and handling. There may be hoists, there may be sling, there may be stand aid. You're going to be trained on how to use some of this equipment I'm mentioning. So you're going to be assisting patients to stand, assisting patients to move. You're going to be assisting them to feed. You may have a patient that cannot eat. It is you who's going to take the spoon or the fork and feed them all their meals, depending on what you're asked to do. You may be asked to check temperature of the fridge in the maybe treatment room. You may be asked to count some medication. It may not be in all areas. I don't know where you're going to be posted. You may be asked to make bed. Yes, that is one of the role of either a carer or a senior carer. You may be asked to make the bed, put the pillowcase on, the duvet, although you will not be asked to wash because there's laundry. I don't expect you to be asked to wash the laundry. So, but you'll be asked to make bed, to arrange the wardrobe. You're going to be asked to make patient comfortable, like repositioning. If someone is there and they cannot change their position, you may be expected to reposition them. Even take blood pressure. Depending on where you're working, you may be allowed, if you're trained and they see that you're competent, to take blood pressure, to take vital signs, some of the basic vital signs. You may be allowed to take them, taking temperature of even both the patient, taking the height. You may assist to serve meal, push the trolley, take the laundries out, bringing back the laundry, the waste bin. It depends on where you're posted. And if you're working at the GP surgeries are like day clinics where you just walk in and go back. They don't usually take admissions. So if you're going to be posted to GP surgery as a senior carer, you may be expected to sterilize equipment for maybe dressing, just equipment. You may be expected to wrap those equipment, put it into the sterilizer, sort it out. You may be expected to do some health checks, basic health checks like maybe blood pressure, vital sign, if you're allowed and you're trained. You may be expected to restock consulting room, restocking gloves, restocking everything that needs to be restocked, like gloves, face masks, every equipment that they may need. You're going to be the one that will be restocking them. Sorry, I'm looking down a little bit on my phone. You may be actually expected also to process lab samples because GP surgery, they take samples as well. You may be the one that will sort them out, arrange them, and maybe prepare them to be posted to the laboratory. So you may be allowed or expected to do this. You may be allowed to even take blood sample. But if you're really trained, because even as a nurse, if you don't train under that particular company to take blood, you may not be allowed to take blood. So as a carer, you may not be allowed to take blood as well, but some may just allow you to even do BM for diabetic patients, or just to check blood glucose level, or even take blood if you're trained. You may be expected to do health promotion, health awareness, education, like just little talk, making people comfortable, calling people in to go see the doctor, and those other things. And I'm going to be talking about a care home because I worked in a care home, and I can tell you from experience what some of my senior carers are allowed or expected to do. So as a senior carer in a care home is a bit different. I think they have more power in a care home than they will have in a hospital or in the GP practice. As a senior carer in a care home, if you're in a care home, listen, if you're in a care home where there are no enough nurses, you may take the role of a nurse. But even if you're a senior carer and you're in a care home, or you're on duty that day and there are enough nurses, you will be a carer. Does it make sense? So you're a senior carer, and usually there are let's say 3 nurses in the care home, but today there are only 2 and you're a senior carer. Yes, you may be allowed to take the role of a nurse, mean that you'll be allowed to even give medication. You're going to be trained. You'll be allowed to give medication. You're still going to be expected to feed, serve food, clean, change diaper, wash the residents, arrange the room, make the bed, sort the wardrobe, check for any abnormalities, paperwork, like recording the time you've checked them, the repositioning, taking them to the toilet, recording the toilet, if they've had the pool, recording the type, the number, the consistency. You will be allowed to do all this. As a senior carer, you may be allowed to give medication, but you will not be allowed to give injections like I don't know, some home may allow it, but the homes I've worked with as a senior carer, you are not allowed to give injection. You shouldn't give injections like the insulins, vitamin B12s. You're not allowed to take blood. In fact, even wound dressing, there's some wound dressing that you're not allowed to do, except it's just a simple dressing that you just need to put the dressing on. You may not be allowed to do the dressing, but if it's a very minor wound dressing, as a senior carer in a care home, you may be allowed to do it. And as a senior carer as well, when the nurses are taking over, you are allowed to join them to take over, especially if you're going to be the nurse that day, like there's no nurse on your floor. But usually from experience, we usually have floors that we work. Like my job, I have a floor. If I'm on that day and there are other nurses for the other floors, even for a senior carer and you have your SVQ3, you're qualified, you're not going to be a nurse when I'm there. You're going to be a carer. And there can't be 2 nurses on the floor. We don't need 2 nurses. So definitely you have to take the role of a carer. And most of the time, except you're employed in a home where there are not enough nurses, you're going to be working as a carer, just the normal carer, what carers do, which is almost the same. The only difference that I see as a senior carer is that you get some pennies, some pound higher, and then they have different uniform. You're allowed to serve medication once you're trained, and then that's it. There's no much difference. So just please put your mind, especially if you're a nurse, I'm going to say this, please just put it at the back of your mind to say, you're not going to be too expectant. You're not going to compare yourself with the nurse. Because you're coming as a senior carer and you're a nurse, you've worked 30 years from where you're coming from, but you've applied to be a senior carer. Just put yourself down and know that you're going to be a senior carer or a carer, and you're not a nurse. It's not going to automatically change that you come to the UK as a senior carer, and then because they see that you're a nurse from your country, then they will automatically you become a nurse. No, you need to go through all the process. So you need to be ready and be humble. You need to know that you are the one who intentionally picked this job, and you shouldn't compare yourself. Even as a senior carer, even though you're a nurse before somewhere, you still have to be answerable to the nurse. The nurse will still tell you what to do because she's the leader on that floor, or she's the leader that day in that home. You're still answerable to them. You have to follow whatever they've said, as long as it's the right thing, okay? Just like I've said in my previous video, usually employer will ask you to have SVQ2 or 3 or MVQ2 or 3 for England. What I want you to know is you need to have some knowledge, because As a senior carer, you're leading the team. You don't expect to come and start asking, how do you do this? How do you do that? When you're supposed to be the leader, okay? So you need to have a little bit of nursing background, a little bit of health background already before you can be able to function effectively. If you're already in the country and you've been into care, you have your master's or you have your BSc and you want to be a senior carer already in the UK, that is easier than you're coming from your country, you have no clue. Even for myself, I've never been to a care home until I came into the UK. So like understanding what they do, even as a registered nurse, was a bit difficult. I had to learn from the carers because everything is different. So you need to have a little bit of knowledge of repositioning, of pad changes, of care, feeding, moving and handling, basic knowledge of these things before you just decide to come and be a senior carer. Because once you're a senior carer, the carers are supposed to be answerable to you. You're supposed to lead them. You're going to be leading the team, telling them what to do and what not to do. So you need to know that you're also a leader as well, okay? As a senior carer or even as a carer, you need to be caring, be kind, be compassionate, be proactive. You need to be cheerful. You need to be able to follow instruction. If you're very proud, I'm telling you, you cannot be a carer or a senior carer. You need to be able to follow instruction and you need to be able to communicate effectively because you're coming into contact with this residents or patients every day and you need to talk to them. You need to have communication skill. You need to be observant. You need to have organization skill. You need to be willing to do the personal care. You know, you can't be changing somebody's pad and you're like, you know, the way you communicate is also very, very important. The way you carry yourself. Usually you're going to be working from around 37.5 to 48 hours, depending on what your contract says a week, and your salary as a senior carer shouldn't be less than 10 point something if you're going to need a visa, or 19 to over 21,000 pound a year. From there you can also even grow yourself. I've seen people who as a senior carer, they have SVQ2, 3, SVQ3 especially, and they went into being a nurse, even though they were not a nurse before. It can help you to be able to be admitted into School of Nursing and to start your nursing career if you're not a nurse already. So that is just all I've come to say. That's all I've come to tell you about the role, responsibility of a senior carer in a care home, hospital, or in the surgery. Okay, I hope this video is helpful. If it is, please, if I've not offended you, kindly like, subscribe, click on the notification bell, and I will see you again in another video. Until then, stay safe and good luck. Bye.